Hey guys, we're just finishing getting set up. We'll start in just a minute. So for everyone joining, what you're going to see on your screen is Connie Mitchell, myself, Lena Ajacek, and also Justin. On the bottom section or on your right section, you're going to have a question and answer. So as we go forward, if you have any questions, feel free to leave it in the Q&A section, and we'll be sure to get every question addressed. Thank you for joining, everybody. Really appreciate it. Can everybody hear us all right? And see the shared screen as well?
Looks like people can hear you.
Awesome. So we'll just give it another few minutes before we get started into the good stuff. So we just got our first question, and it's, is everything being recorded? And the answer is yes. This will be recorded and available at a later time for everybody to view. Justin, Connie, you guys ready?
I'm ready.
Great.
Okay, let's do this. Hi, community. Thank you so much for your interest in Chinatown. We really appreciate your love for the area, support for making sure that Chinatown continues improves, and really advocating for what's best for the community and area. So this is a forum that we're going to be hosting. IHS, we're a 501c private nonprofit. And we have a series of programs. One of those programs we're proposing to do in Chinatown. We currently already do work there, but we'll go into a little bit more on how we're planning to engage with the community. So first we're gonna go into our agenda. So we'll just do a brief introduction. We'll go into what Chinatown, the current situation is, which many of you folks know, which is really why we're all here. And then we're going to go into the work that IHS currently does in Chinatown, what this proposed project looks like, and then do some question and answers. And really the question and answers will be the meat of today's meeting. But we do want to make sure we're giving some time to give a good background on who IHS is and what we are proposing, so that we're all coming to the table with some basics. So I'm going to be introducing Connie Mitchell. She's our executive director for IHS. She's an APRN, a nurse practitioner. She's been a longtime advocate for the homeless community and for the improvement of our community in general. And so you actually might see her sometimes in Chinatown doing some outreach work, helping to get people off streets. And then we also have Justin on the phone as well. He's our outreach manager, and you've probably seen him in the streets of Chinatown as well. So I'm going to hand it over to you, Connie.
Thanks, Lena. I'm just really glad we have a chance to share a little bit about the project that we're proposing. And I say proposing because it's not something that's in hard concrete yet, because we had very little time to put something together. And we really wanted people to, just know that we were interested in serving a particular population. So, I want to tell you a little bit more about IHS today, though. Most people know us as being the Peanut Butter Ministry that started over 40 years ago by Father Claude Dutillon. And he is someone that I think was just an icon. He really knew how to engage our community, and I admit that I am not the same type of person, but I try. And so there's Father Claude Dutillon with a lot of people, and he really just had a heart for the homeless. And we likewise have tried to keep that same spirit of really caring for the people that really had nowhere else to turn. But you know what? Over the 40 some odd years, we've really grown, and we have grown to have a lot of different programs. We have the emergency shelters, but not only the two men and women and family shelter, but we also have one at Sand Island called Halemaliola. And that one is the containers that are divided up into individual units. And we also have medical respite shelters. You know, these are in houses for people who are coming out of the hospital. And we also have a recovery house, you know, that is specifically geared for people who are wanting to launch their recovery into substance abuse treatment. And we have a lot of folks who are dually diagnosed with mental illness as well. The rest of it you see on the slide. We have the meal programs. We also distribute food. We have a children's program, and that's been really expanded. We've gone into Kahawiki Village, where we manage a lot of the programs there. And then case management, veteran services, outreach, housing placements, of which we've had many this past year. And even during this period of COVID, we've continued to place people, over 200 people during this last 2 months. And employment, urban agriculture, and a wellness center, which is really the core of our street medicine team as well. So this is just a slide, you know, sharing with you a little bit of the statistics, you know, of what we've been able to do in the last year. And you know, I think we feel like our strength is being able to match people up with the kinds of services that they need, because we all know that not all homeless people are the same. And when people need services, we tend to try to find the service system that actually serves them the best and link them up with them. So what do we see in Chinatown? You know, we had a lot of questions when this news of this potential proposal was published in the paper. And people said, why Chinatown? And I think for me, you know, I would see and hear about all the things that were going on in Chinatown. And part of that was actually from Chinatown constituents. So, I actually wanted Justin to share a little bit more about, you know, some of those kinds of business, because we get referrals for outreach. So Justin, I'm going to turn this over to you so that maybe you can share a little bit more. Okay.
Thank you, Connie. You guys can hear me loud and clear? Okay, hope so. My name is Justin Phillips. I've been with IHS a little while. Homeless outreach manager down in Chinatown and around the island of Oahu. Any rate, very exciting. What we're seeing down in Chinatown right now is a lot of people come into the area due to what happened to the parks around in the surrounding areas. We had many of the parks shut down. There was no services being applied. So people congregated into Chinatown. And what we're seeing is that they're sticking around. And some of these folks we've been seeing that are, you know, inebriated, very drunk or intoxicated. What we've been doing with these folks is trying to help them. A few of the folks you guys see in the slide now, they were sent to us. Both of the two gentlemen in the wheelchairs have been removed from the area. They currently are getting services and housing outside of the area now. So we've been able to address some of these needs, and we feel like coming into Chinatown, being in that area would help us to be able to provide a much quicker response and provide services to people in a much different kind of way. Currently, you know, we might have to wait 72 hours to put a person into substance abuse treatment, get them access to shelter, get them access to a place, but where do we stabilize people at? And so what we find is when we tell people, well, you have to wait until tomorrow, people become discouraged and no longer seek treatment and things like that. So we feel that, you know, this might benefit the community, be able to take some of the people that are the most sickest, the most hardcore cases, be able to help get them out of that area in Chinatown. We feel like the folks down there would probably benefit from that kind of service. At any rate, I'm gonna turn it back over to Connie to talk about the program overview.
So before I go into the actual program that we're proposing, I also wanted to add that a lot of the successes that we've had have been because of Justin's team with a psychiatrist that has really on the street down there. They actually work to get people taking medications, sometimes you know, medications that are actually long-acting medications through injection that last for a month or even up to 3 months. And that makes a huge difference in terms of what can be done with someone when they finally have a regular stream of medications in their body and really bathing that brain of theirs so that, you know, they can really wake up and be able to have some semblance of being able to make decisions. Because we really see those people who are deep in their addictions and deep in the mental illness as people who are very, very much impaired and in fact disabled. And so when people as being disabled, we really want to look at how we might be able to help them. So, and along those lines, in the last year, probably last 10 months or so, we've also been actively going after court orders to help people with these kinds of treatments so that we really, are able to treat them over their objection. Because many people, when they're mentally ill or when they're so addicted, they're not making any good decisions. And really someone else needs to make that decision for them because they are disabled. Just like if you were to see an elderly person in a wheelchair fall over, you wouldn't just leave them to just try to get up on their own. You'd really go and try to help them. So similarly, when somebody's mentally impaired, we want to help them. So that's kind of the context of what we've been doing. A lot of the different types of programs and work that has been a part of IHS now in the last few years. So what is this program about? This new Chinatown proposal for a Chinatown homeless triage and care station. It's really a place where we can untangle that web of resources that are really needed to help someone begin a path to wellness. I'm telling you, it's really hard to get a chronically homeless person off the street. It takes a lot of time sometimes, takes a lot of different resources that come together in a way that really will help them. You know very well, so many of the questions that I had have been about, well, when things are going down bad, and we know that it's really bad in Chinatown right now, the police seem to have their hands tied. And truly, they would say the same thing in some ways also. And so for us, we're about trying to work with the police, work with the hospital, work with the clinic or the street medicine team that is with us to be able to put all of that together in a way that comes together at the right time so that the person will be able to accept services and it will be the right services for that person. This triage station that we're trying to propose is a place where we feel we can do that better. We need to be close to the people because a lot of them can't even walk over to the Punawai rest stop or to our shelter, which is just in Iwalei. People ask us, why Chinatown? And so we're just feeling like, it doesn't have to be right there, but we feel like we need to be close and we need to be, close enough so people can actually be brought there, rather easily. They won't go with us sometimes when we ask to put them in a car, you need to take them to another place. So it's really the female to be able to help clean them up, help them feel a little bit more humane, get them into, get maybe a night's rest and, just really help them make a move to the next place. So this place that we're proposing really is meant to, 4 things, that I wanted to say. It's really to reduce the risk of COVID infection for the community and those who are shopping, dining, and just visiting Chinatown. We want to reduce loitering and disruption and the disruption of the peace and comfort of people who live there and work there. We want to get chronically homeless individuals off the street permanently, not just a temporary thing, but get them off the street and in doing so, help revitalize the area that has been so heavily impacted, even early on when we didn't even have the shutdown. I know that people stopped going to Chinatown and it's really something that we really have to work hard at to revitalize that area. So those are the 3 main things, objectives or the goals of this place. It would be a place where we can take someone to be assessed and diagnosed. So it isn't some place where we expect people to line up because it's not a shelter. It's a place that we're wanting to just really deliver the types of services with that person in an intimate setting so that we can convince them that we have something of an answer for them. We want to be able to, really focus on the people who are most chronically homeless. And in the last point in time count, actually, the urban core area was the area that had the highest concentration of chronically homeless, unsheltered people. So we know that this place gets more than their share of these folks who are really, really vulnerable and homeless. So, it's a real short-term kind of intervention for people who may be at risk for spreading COVID. They're not COVID positive. We're not bringing people who have COVID, into the area. It's really to take them off the street and get them somewhere else where they won't be as much of a threat, a public health threat to folks. Because it's not just COVID, their lifestyles lend themselves to people developing other infectious diseases, and we really don't want that kind of outbreak in Chinatown particularly. So these are people that don't know how to know that they have to wash hands, wear a mask, social distance. You can tell them, but they're not going to necessarily do it without a lot of help. So we're there to just really try to help either remove them from the street so that they can not be as much of a threat and move them someplace else, or at least get them doing some of these things. I think the on-site sleeping services are very short-term, so we're not opening our doors at night, for a lot of people to come in. It's really to try to take people off who are ready for that next step, and we're not, really thinking to be serving a whole lot of people, but they're very, very specifically those chronically homeless people that are, typically the most problematic, down in Chinatown, the mentally ill, the people who are public inebriates, people who are addicted to other substances that cause them to commit crimes because they're looking for more money to exchange for drugs. I think the center expects to treat maybe about 17 to 20 people a month, at most, because we're really looking at spending the time doing the important connections for people to get onto that next step and following them through so that they stick. Because it's too easy to just, if we put everybody in housing, they wouldn't necessarily stick. We need to have the services that really help them to be successful where they're going. And that's where I think IHS has demonstrated our ability to do that. We have a Housing First program. It's been very successful in keeping people in, not shelter, but in housing, by teaching them how to be tenants, really. So that's in a nutshell, what we're proposing. And, we're really thinking is something that I think is not in conflict with what, the Chinatown community wants. I know that it was sprung on you. I really apologize for that. As, Lena mentioned, we had a very short period of time to put a proposal together, but it's really not something that's going to happen very quickly anyway, no matter what. So we're really split at this point. And I noticed that we have some participants' hands raised. Lena, I don't know if you're able to take their questions.
Yes. So I think that's our overview, and now we're really going to spend the rest of our time today going over everybody's questions and getting as much as we can addressed together. I think as we go through these discussions, we really, myself, Connie, and Justin, we go to Chinatown, we shop in Chinatown, we frequent Chinatown. We do want what's best, and IHS does want what's best for the community. So we're really hoping that together we can work towards a solution that's going to benefit the community. We have a combination of questions. We have some in the Q&A, some also in the web chat, and then some that had been pre-submitted online that people who couldn't make had asked us to address. So I'm going to start off with Caroline Oda's question. Connie, how many sites are you considering?
Sites for this kind of service. We actually deliver this kind of service through our shelters already, but for a lot of the people that we're really focusing on in Chinatown, we can't bring them to the shelter. They're just too mentally ill and they're too disruptive to be in a congregate shelter. So that's not a possibility, but we're really looking at least to begin in Chinatown. And, we've been doing work in other communities as well. We have outreach in the East Honolulu area, so we cover Waikiki. We also cover the windward side, all the way up to the North Shore. But in every place else, we've had a place where we can sort of work out of. And, we've never had a place that really, where we could control more. And that's what we were trying to do here.
Okay. Got another question. What is the primary population that you're going to serve? So who will be at this site?
I think I mentioned that it would be the chronically homeless people. We want to target public inebriates, people who are sleeping in the doorways of Chinatown, often with wounds on their legs and stuff. And then also the people who are mentally ill, people who are just oftentimes yelling, all over the place and really not knowing what is going on and not able to control their emotions.
Awesome. And so Roberta Oakes had a comment that this will attract homeless to the area. Will this be attracting homeless to Chinatown?
I think if anyone were to look around Chinatown, you know that you already have, as I mentioned earlier, a large contingent of people who are in the Chinatown area who are chronically homeless. We don't expect it to attract more, and simply because the people that are able to come into our, this station are really people who are accompanied by our staff. And so what we're doing is really having them spend a brief time with us and moving them out of Chinatown. So to the extent that I think we would not be allowing people to congregate outside our doors, we would be redirecting people to the Punawai rest stop or to our shelters if they're more appropriate there, or actually calling the police in some cases, because if they are doing things that are illegal, we would definitely be reporting that as well.
Awesome. And can you talk about the other services you provide in and around Chinatown?
So right now we have outreach in Chinatown that is specifically for some of these mentally ill folks. And I think Justin can share with you some of the, I don't know if he mentioned some of the successes that we have had, but we can definitely do what we want to do more. We have been at the Joint Outreach Center for a bit, and so we redirect people to the Joint Outreach Center, but recently H4 moved out, and so the clinic is not there right now. And we were trying to redirect them to the other clinic that was out at our shelter and also the one that is at the transitional quarantine station that was open specifically for homeless.
Awesome. Okay. And then what will the services be provided on the 3 different floors? I guess the question is from Lynn. Will you be using all 3 floors, and what services will be on each floor?
We're still kind of exploring that, because originally when we were thinking of having the whole building, we were actually going to move our outreach team into the building. They actually go out from an office right now outside of the area, down more by Kapulani, but we were wanting to move it there and have our intensive case management team, which often will address some of the people in Chinatown already, that we want to basically have them closer to the folks that they're working with to get them out and more intensely motivated as well. So one area on the 2nd floor was going to be for offices, for our teams. And then we wanted the lower floor to be more accessible for the people who are ADA, need an ADA access. So we would have, showers and just a couple of showers, but bathrooms. That was one of the problems we had at the Chinatown Joint Outreach Center. There was no toilet, no showers, and we couldn't really help the person get cleaned up so that we could then take them to the next program. And that's one of the things that we really want to be able to do.
Awesome.
I think that, and the top floor, sorry, I forgot the top floor. So the 3rd floor, was for those times where we really did need to have the person just maybe sleep off, like a person who's a public inebriate, to be able to sleep off the alcohol, and then maybe in the morning be able to have that conversation with them about, what do you want to do now? They're more lucid at a certain time of the day. And that was one of the strategies that we had, was to catch them at a time where it was they're more easy to talk to, because they have a little bit more, of their mentation on board at that time.
Awesome. Okay. And then following up on the location, this question's in our question and answer in the chat section from Anne. How many beds for overnight stays do you envision?
Right now we have up to 6 beds only, and we don't expect that they would all be occupied all at the same time. So it's really, we want, because we have the experience that when somebody comes in, you have to have some time to actually clean it up after they leave and everything. So we just want to have available that many beds and to be able to move people along quickly, because the window of time when somebody is ready, to accept treatment or to go into detox or something is very short sometimes. And to be able to do something for them in the moment is tremendous. It really enhances our success to just help them take that first step, and they can feel better. And then after they feel better, they take another step. And so the whole idea is to move them towards wellness, whatever that takes, in terms of mental illness or substance abuse or their medical, issues, because many of them have chronic medical problems or wounds that are very, very infected.
Awesome. Okay. This one's from Eve. And again, we're going to answer as many questions as we can. And so if they go into the Q&A, I can be sure to address those because they're saved until we answer them. So this one's from Eve, and it says, Chinatown already has major issues with homeless at my front door every day. How do your operations won't cause more issues in terms of safety? So I guess the safety component, Connie.
I think, we know that there's some safety issues already. I think law enforcement has a role, but I think our role, and maybe Justin, you can jump in also, is, maybe to be able to be more responsive if we're closer by. It's really tough, when our team is already occupied, elsewhere, and we are, assigned, to other places. But should we have the honor of being in Chinatown, we would certainly want to be able to respond more to, our neighbors. Right now, we do respond to the people who are around our shelters, and I can tell you that, I know one of the questions that I had already fielded in the email earlier was about, the people congregating outside. And, people are really afraid that it's going to be like that because they see the people congregating outside of IHS. Well, I think most of the time we do have people who are congregating outside. We have actually advocated for that whole area to also be included in Sit Live because the people who are there are not our people. I'm just telling you that they are people who have been exited from our shelters most of the time, and they won't, leave because they're still wanting, the food or services. They don't stay in the shelter, but they still want the, like to be close to Punaway Rest Stop or to be close, to the meals that we serve because we're serving a lot of extra meals that are takeout also right now so that people can take it and go. So I think overall, we try to honor the idea that we need to keep our spaces on the sidewalks clear for the public. And, we're one of few organizations that, really do support it, I think. But, we really want people to know there's an expectation, a public behavioral expectation that really everybody needs to honor, not just, be exempted because, you're homeless. If you're homeless, we have services for you. We want to try to tailor those services as much as possible, but we want to work with people. And if they don't want to really do anything, it's real difficult. And sometimes we feel like, law enforcement does have to step in.
And I guess following up on that, we have a comment from an anonymous attendee saying that, IHS is only one provider. So what is it going to take to truly address the homeless issue in Chinatown?
I think, one of the things that I see as part of Partners in Care is that we need to start working more together. I think we already are. I think IHS has been really trying to, we welcome any new homeless service provider, and we try to put that into our quiver of, solutions. Because, there's so many different people, taking a sliver of, folks who are homeless, and they get really good at it. And we want the people who specialize with certain people to actually help those specific people. And I think our, specialty, I think, is really helping match everybody, each person, to the right set of solutions. And so I think that as we have more of that capacity to for more people, and then we're linking them with specific programs that are in existence over there, I think we will have more success. But I also want to point out that right now, our service systems are very dysfunctional, for lack of a better word. We have, laws that don't allow us to treat people very readily for, their mental illness. As I mentioned before, we have to go to court. And I can just tell you that some of the pain that I have is, right now we're going on 6 months trying to get this one gentleman that I think most people are very familiar with in Chinatown. We have gone into court to get an order to treat on this man. And time and again, we've been thwarted by, the the defender or the person who's representing him in the public defender's office. And we have to jump through these hoops relative to the legal system. And for the courts to be shut down the last 2 months just added to that time. And it really pains me because I feel like this guy needs, medication and treatment now, but we've had to wait, and we just keep pushing because we know that this is what this man needs. But, it's really about finding out what system is best for that person. Another thing that's really difficult is, understanding the system by which you get somebody into the hospital, and the hospital has a right to also treat them. Just because you get somebody to the hospital and take them off the street doesn't mean that the hospital can treat them right away, because if they refuse and they don't want treatment, then the hospital releases them usually if they don't pose a danger. Now, I happen to think that the system could be tailored, so that if you get an order, say somebody reports this person and the police picks them up, and they get taken in on what we call an MH1 or a mental health evaluation, that at that point in time, if there was a way that we could get the courts to actually say, yes, you can also treat him, not just take him in, but hold him and treat him, then I think because he's demonstrated danger already, then we might have a better system to really get some of these people off the street permanently, because then they can actually begin a journey toward wellness and recovery that could actually end up helping them to get housed again.
Thanks, Connie. So this one's from an anonymous person. IHS has a great proposal in Chinatown. Is there a contingency plan for those who will come with one-way tickets from the mainland once the state lifts up travel restrictions?
Well, we already have a program called a Relocation Program. We have actually returned over 500 people back to their places of origin on the mainland, and sometimes internationally as well. I think this has been in the last few years that was begun by our work in Waikiki, and we intend to keep doing that. We do get private funding to help us do that, and we're very, very grateful for the folks that see that as a real economical way to help our state, because taking somebody off the street and getting them back home. In fact, we were just dealing with somebody today right across our shelter here who was very, very drunk. And, once the word detox was mentioned to him, he kind of stood up and he said he wanted to get detox and he wanted to go home to Seattle. So we're going to send him home to Seattle. I think, those are the kinds of opportunities, when we see them, we really want to just jump on. So, yes, we really do want to relocate people, but we don't want to just send them back to be homeless someplace else. Every person that we sent back, we check to see whether they would have a place to stay and that someone has agreed to actually take them in when they got there.
Thanks, Connie. Okay, from Robert Armstrong. And again, just remember to put your questions in the question and answer section so we can go through them one by one and make sure we're getting them all addressed. So again, from Robert Armstrong, do you plan to address the neighborhood board next Thursday?
Yes, we do. And I so apologize that we haven't had the opportunity to connect with more people like the neighborhood board, because we just really got just everything just blew up when the thing was announced in the paper, and we didn't have a chance to even let people know what we were trying to do. So I definitely would be there at the neighborhood board and be able to answer questions and to just really talk with you. And we're not, as I mentioned at the beginning, this is not a proposal set in stone. We are looking for community input, and we are open to whatever ways we can actually execute this in a way that would be could be better for the community. So please give us your input.
Thanks. So I guess as you guys have questions on possible solutions that you think of that could help get people off of the streets of Chinatown, please type them in the question and answers as well so that we can discuss those. So this one's from Shade Group. Why not consider creating a mobile triage and care station? Then you can go to the epicenter of need and eventually redirect it towards more established facilities.
I think we, in some ways, are kind of mobile right now, but that's a great idea. You know, I think if there, I'm not sure how mobile or how big a place, you know, that would be. But, you know, as I mentioned earlier, we wanted a place where people could, you know, rest and actually have an overnight. And I'm not sure, you know, whether the Shade Group has, you know, some proposal, but please, you know, share them with us. We would really like to explore that with you.
Awesome. And then I guess in follow-up to that, Connie, what is the difference between the outreach that is currently going on and the proposed location? Why do we need a location versus just doing the outreach?
I think, you know, maybe Justin, you can answer that question.
Sure. Yeah. So in the Chinatown area, very targeted outreach towards directed directly at dealing with the inebriates, directed directly at dealing with folks that have mental illness, folks that are causing a crisis in the community. Some of the questions have been around, are we gonna, you know, what kind of services are we providing? We provide medication management for almost 100 individuals currently. Of that, we have evaluated 27 people for the petition, the ACT petitions. Of those 27 people, 3 are taking medications now. So by being very targeted, and what I'm trying to say is we have 100 people taking medications, 3 people on the act. So most of the time, once we engage people, we're able to get them onto these long-acting medications. We're able to get them into these programs and get them out of the area. We have a very good proven record of doing that. By directly targeting folks so they have, you know, alcohol problems and mental illness, and working with them, we believe that we can be very effective in the community. One of the strongest relationships we have is with the local providers, Safe Haven, Mental Health Kakua, the River Mission, also HPD. HPD has been a valuable resource in that area. So by being a little bit more intentional, I think that we would have a much greater impact on the local community there in Chinatown. Thank you.
I think I want to add that, you know, the ability to actually sleep people overnight is a big one. And the ability to bring somebody in to actually clean them up is a big one. You know, this idea, and I shared this at the city council, the idea for this actually came about when we were having our discussions over outreach, and Justin had shared that there were a lot of people that were walking around Chinatown with shaved heads. I said, well, why is that, Justin? And he said, well, they were just infested with so much lice that they had to shave their heads. And it's really about, you know, trying to find a place where we can clean people up so that we can actually do more with them and actually get them to sleep so that their brains have a rest and they can take a break from being, you know, so vigilant because they're being assaulted or, you know, just traumatized by being, you know, robbed of, you know, different things and stuff like that. So it's really so much experience just literally makes them mentally ill, you know, and we want to take them off the street so that they can regain, you know, their mental health a little bit so that we can talk to them.
Awesome. Okay. We have Amy Brown just checking in to see how many people are on this Zoom meeting. She's just curious. So Amy, there's about 153 to about 155. So this is definitely a topic that the community cares about and has a lot of comments and thoughts on. In the Q&A, we additionally have about 74 open questions and only 9 have been answered. So we'll try our best to get to everything that we can as we keep going. From Harry Palmer, what other Chinatown sites are being considered?
Well, like I said, we didn't have time to look around too much, but we do have a friend that I just met this morning who is actually looking around for possible other sites for us. So as I mentioned before, it's not like a, you know, something that's cemented in stone right now. And, you know, if there are people out there that have suggestions for us also, you know, we'd really like to entertain them.
Mm-hmm.
Yeah.
Next question. Is there any way for people living in the neighborhood to help your work?
Yes, and in fact, you know, just reporting some of the things that go on, and
Right.
even those photos, you know, as gross as they are sometimes, you know, they help because, you know, when we go to court, what we are doing is we're bringing videotapes of certain people as we are petitioning for them before the judge. And that really helps. You know, you are our eyes and ears. You also let us know when some people are really problematic. And so, you know, if they're mentally ill right now, you know, Justin definitely wants to hear about them so that we can find out more about what we can do. Sometimes they're new. You know, I in speaking to this gentleman earlier today, he was telling me, you know, I've seen the people in Chinatown really change, and that there's really a lot of new people that are coming through, and they're not a static population. And we are aware of that. And we're also aware of some people, a smaller group of people that remain there, right, Justin? You know, they've been there for a long time. And, you know, it's some of those people that we have, you know, the greatest heart for, but we definitely have a solution that we want to apply to whether they're new or they're not. One of the things that Justin might have mentioned earlier was about some of the new people coming in that are more violent. We tend to think that they are part of the contingent of people who may have been released, you know, from public safety, and you know, they're drifting, you know, this way. At least we see some of them, you know, in our shelters, not necessarily the more violent ones, but they may be going back to areas where they had come from before, you know, and that may have been a place.
Awesome. So we have some questions specifically on COVID. So how many positive cases of virus have been recorded among the homeless population?
None, which I'm really, really thankful and proud to.
For Oahu.
Yeah, for Oahu. I think on Maui there was one. I don't know if there was any on Hawaii, Big Island, but I think there was only one so far. And we are very, very fortunate and very, very thankful. I know that when the COVID crisis began, we were very early on jumping onto making sure that we were doing everything we could to identify, you know, through surveillance, also to just take temperatures every day. To this day, we're still taking temperatures every day of everyone coming to our shelters. And the outreach team has also been doing, you know, some of that out in the field as well.
We're utilizing the Survey 123 app for COVID screening, which is something that we were able to help develop with Partners in Care, which this has proven to help us track any kind of trace, any kind of antibody tracing and all that kind of stuff for COVID-19.
Mm-hmm. Mm-hmm. So how does this facility propose to protect the community from COVID?
I said earlier that, you know, what we're trying to do is to remove people who potentially could be vectors, meaning, you know, they're very vulnerable, number one, you know, to being infected, and they are not doing the things that everybody else is doing, like wearing the mask and doing the social distancing and washing their hands. So what we're doing is taking them out of the community so that they're not, you know, potentially infecting other people.
And then how will IHS prevent public loitering and encampments near the center?
We respect the laws, you know, that really prohibit them, and we would be asking for the police when it's appropriate, and asking for the Department of Facility Maintenance to do the clearance that they do as well. But even beyond that, I think for us, if we were a facility down in Chinatown, I would suspect that we would be doing power washing of sidewalks, you know, to just make sure that the areas right in front are clean and clear, and that we, you know, would definitely be redirecting people to other services that are more appropriate, like the Punawai rest stop and like our shelters also.
Okay. And where will individuals go after spending time at the center?
It could be coming to one of our shelters. It could be coming to, you know, a medical respite bed. You know, they're going to be opening medical respite beds at Kowili Street in Iwilei. So it could be going to substance abuse treatment bed, or maybe finding shelter and then going into permanent supportive housing if somebody's mentally ill, or even finding a mental health group home. Or if somebody's really, you know, needing a foster home, an adult foster home, we could even work with their health plan to find something like that. So I just want to say, IHS is very used to finding different types of discharge destinations that are more appropriate for the person. And everybody, needs a different solution. And so we really want to make sure that the one that we work with them to set up is one that they want and that they will actually accept.
Okay, question. This one's for you, Justin, from Anonymous. We already have lots of people making noise and issues at night so that it's not safe to walk around. And also it's hard to sleep with the noise. Why are we placing outreach near this area?
So we would like to actually bring in a little bit of a night outreach program to help address some of that. Obviously, if people are out drinking late at night, making a public nuisance, maybe HPD should be called. But for folks that are homeless, needing services, we'd like to be there to help, triage and intervene in their lives, maybe offer them a different choice or resource. What we found is that we believe that we could actually, in effect, be very effective down there. Last year, I think we did 546 encounters at the Joint Outreach Center. That's not counting the folks, that came in from other areas. We weren't able to see them at the JOC, but that we actually seen them walking around in Chinatown while we were trying to encourage the 546 people to go into the Joint Outreach Center that was already in Chinatown. Again, we would really like to see people not hanging out outside of our buildings. That is something that we're really that's a sticking point for us. We don't want people congregating. I see some of the questions are about how many people will be allowed in the building. It's probably going to be something like one staff member, one client. We don't want people it's not like a day room where people can come hang out. It's where we're bringing people in, having an assessment done, understanding, okay, are we going to send this person to detox? So if they're up late at night, or whatever, they can bring them in, have that conversation. What are we going to do next? Do you need a place to go? That kind of stuff. So maybe helping to remove some of the people and giving them a place to have somebody that will listen to what they're going through. That's kind of our hope, we would like to learn how to do this with some of you folks. We've been doing really well in some areas, but some of this we might have to do together with you as the people in the community. So I look forward to it. Thank you.
Lena, I want to answer a question that was asked earlier too. Someone asked about what other people can do. There's a lot of people who are helping some of the people who are homeless right now, and we'd love to be able to partner with you. A lot of times we have a lot of these other services. You have the relationship with some of the folks already. And if we can leverage that relationship and you can convince them maybe, to take another step and we can move them to, we might be able to move them a lot farther than, either of us. So I'm just really, excited about doing a lot more of that kind of partnership as well.
This is one related to COVID and what's coming in the future related to our economy. Are you bracing for more homeless folks, including families with kids, in Chinatown once the eviction moratorium lifts?
We actually applied for another program, which we were also awarded through the Emergency Solutions Grant under COVID, which is actually directly looking at helping those families, who are affected by COVID. They were working before, maybe and lost their job or lost hours. We will be able to help them with their rent, maybe trying to catch up with back rent or trying to help them negotiate something with their landlord. So yes, we were anticipating that would be an issue. And that is another program that we proposed to the city, and we were fortunate to be selected to actually implement. So that goes before the city council as well next week, I believe.
Okay. Is there a sunset provision on the center, or what will happen after COVID calms down?
Say that again.
This is from David Mongold. Is there a sunset provision on this center, or will it become permanent?
I think for us, we are an evolving organization. You can ask my staff. We're always changing because we're always trying to meet the need that is actually there. And, as COVID winds down, I think if, you know, the Chinatown area thinks that this isn't something that's needed, although I think, you know, what we're doing is something that is for chronically homeless people, you know, and that's not specifically for COVID people, but it is a service that is related to the COVID problem. So even when COVID dies down, I think that we can definitely move people, you know, into, you know, our staff into like different programs, but we could still continue to work with these chronically homeless folks. I think one day, if, you know, we didn't need service, we could use the building, you know, it's supposed to be used for homeless people. I think we could maybe start like a business, you know, down there with homeless people, maybe, you know, who want to work and, you know, do things like that. You know, we're very, very flexible and nimble about doing things differently, that we don't stick with a program just because we've had it forever.
Next question. Why pick an area that's so densely populated? Why not have it in an area that's less densely populated?
I think, you know, the whole idea was to be closer to where the people we are actually focusing on are. And because there is such a dense population of unsheltered people and chronically homeless folks in that area, that was the rationale behind, you know, our selection. You know, as I mentioned before, you know, it's something that we did out of our observations and the data collection that we do. But, you know, if the Chinatown community doesn't see that as a problem, I mean, but I think we agree that we have a problem here, and we really want to be able to work with Chinatown residents and business owners, you know, to really make it a better situation.
So we have about 10 minutes left, and we've answered 18 questions in the Q&A, some that had come online, some that were in the group chat. We have about 100 questions still pending. So what we're going to do is keep going through the questions and answer as many unique questions as possible. And then from there, what we're going to do is make sure that if you submitted an individual question, we're responding in a chat as well. So this one's from Anonymous. My mom was a nurse in a psych ward, and she noticed that once the homeless and drug addicts run out of welfare, they seek out service to clean up until they get money again and go back to their old ways. So I guess, how would this help? Yeah.
I think our long-term goal is to not just get people off the drugs or, you know, off or, you know, medicated, but it is about building a new life for people. And they need to be part of a community. They need to be part of a community that accepts them and wants them to exercise their gifts, you know, so that's what we work toward. But, you know, that requires our community to be willing to accept them as well. But, you know, our goal is to really plug people back into life, not just, you know, have them stop doing something, because we know that it has to be replaced. If you stop an addiction, you have to replace it with other activities that are productive and contributing to our community.
Okay. This one's from Caroline Oda. What are the requirements of your COVID funding? How does it limit funding for current sites like H4?
It doesn't. You know, the COVID funding was put out there for anyone to apply for, and there were different pots of money for different purposes. So there's some of the COVID money that went directly for testing or treatment, and then there's this money that was proposed. We just proposed it as for prevention and for, you know, improving public health. You know, so it's not limited. There's different ways that we can do it. It was up to the proposers to put forth, you know, different proposals to the city.
Okay. And can you talk about this program in comparison to other existing Chinatown services like River of Life Mission and Mental Health Kokua?
From what I know, River of Life, you know, is serving meals, and they are trying to help people with employment. You know, they're training people so that they can actually get back into the workforce. We do both of those things as well, you know, in our shelter and our program. And we were even kind of talking about partnering with River of Life when they were considering coming out of Chinatown. So we have high respect for them, and we partner when we can. Mental health Kokua, we respect as somebody who's skilled in mental health as well. They have a great program over there that helps with, the Safe Haven program helps to house, some of the folks, and they have a day program where people can drop in. But I also know that they have more, business than they can handle. I think the idea is that we don't want to create, more crowding and lines. I think River of Life, somebody had said before, there are some lines out there because of the fact that they're serving meals. We don't expect to look like that at all. As far as Safe Haven, it's a congregation of a lot of people, and they have a great service of providing that shower and bathroom for people. But that's not what we're trying to do either. They have the Punawai rest stop for people who just want to get cleaned up, and they can. So we would really want people to go there if they're able to. We're really talking about people who are disabled that we want to really reach out to. It's not the same thing as a lot of the other services that are going on. Other ones that go on are like H3RC Hawaii Health and Harm Reduction Center. They do a lot of street medicine. And they also do needle exchange. They really are trying to help some of those people who are addicted, but we want to help them in a different way. And I think our desire is to go beyond like the day-to-day. We want to really get them into housing and into a new life. So that's really, for me, the bottom line is the answer to homelessness is establishing a new home.
Mm. This one's from Senator Rhodes. I live very close to the proposed site. There are almost always mentally ill people at the bus stop in front of my building. If you could get them off the streets, that would be great. But how do we know this site won't just make the problem at the street level worse?
I suppose we don't know for sure. I think the things that we've shared today are really in an effort to tell you what strategies we have, we hope to put in place. I think that we, as I mentioned before, have a pretty good working relationship with both HPD and the city and the Department of Facility Maintenance. We are trying very hard to partner with whoever can really help in different ways to engage people, but also give people alternatives. So I can't guarantee. We are really saying we have experience and we are wanting to apply that experience to your neighborhood. And we want an opportunity to do that. But of course, we know that that isn't something that we can just decide on our own. So we just humbly ask that you consider our ask.
And this one's from Roberta Oaks. Connie, do you work with people on the street face to face?
I do.
Yes.
I don't do it real frequently, but I do. I've been down at the post, the provisional outdoor screening and triage center. I've gone on outreach with Justin before. And just last week, I walked Chinatown because I really wanted to know what I was getting into more these days. I know that things change all the time, and I really wanted to see for myself. And just the other day, somebody had suggested, I think it was Hillary across the street at Honolulu Tower. She said, Connie, you really should see Chinatown like at 10 o'clock at night. So I called Justin up and we're going to walk Chinatown at night and see what that's like also.
Thank you. Okay, and we have somebody requesting that we publish a list of Q&A question and answers as the community continues to put up questions and responses. So that will be on the website. If you go to ihshawaii.org, you can go to the link right off the homepage, and we have some questions there. This video will be posted. We'll also continue to answer Q&A there as well. Okay. Sorry, I'm going through so many. We still have 104 questions, and I'm going to try and get to as many unique questions as we can. And if I missed your question, just write it again at the end and we can make sure we are getting it addressed. You see any ones on your side, Connie, that you want to?
I can't see them.
Okay. So this one goes back to the location, and a lot of people have questions on the location. Why this area? So why not locate this center near Dole?
Oh,
Dole
The old
theaters.
Hilo Haddle, the old
oh,
Hilo
okay.
building.
I think, when we thought about creating this station in Chinatown, as I mentioned before, and I don't know if the person, had heard me earlier, but it really was with the idea that so many of these people are disabled and that it would be easier to move them off the street if we had a place very close by to them. And that is really the critical, thing about being able to be in Chinatown. We will still, do the work of trying to get them out, and we will try to get them over to Iwilei and try to, move them off. But I can tell you that it just makes it that much more difficult when we have to somehow line our, our cars or our van with something so that we can bring this person in who's just caked with feces or, urine and, just really not in their right mind. Or someone who is so drunk that they really, they're not going to remember the next day, what happened. And I think for their sake, as well as my team's sake, being able to bring them somewhere where they really can get cleaned up is really huge. And I don't know about you, but for me, if I haven't showered for a couple of days even, it's going to be really hard for me to feel good. And these people have not showered in weeks a lot of times, or months.
Okay. So going into a little bit on the medical side, does medical insurance make a difference in services received?
No.
Nope. I mean, we will see whoever, but what we do, as folks do right now, is they find out, if they have health coverage, and we engage the health plan in helping. We really, to being able to help this person get the right kind of care. If somebody needs to be in a foster home, we push for that person to be eligible to get into a foster home. It's not okay for them to just say, oh, go to the shelter, or something like that, because they just don't fit in the shelter. We have so many people and we're trying so hard to meet so many needs that when somebody needs special attention, it is very difficult to give it to them in a congregate shelter.
And this one's from Carol Fukunaga. Many of the businesses and residents who are on this call have been angry about the lack of sensitivity to their questions or concerns about this project. The late notice on the project was a concern. So can you speak to the late notice?
Sure, and I really, again, as Lena said, and I said earlier, apologize for that. When we started down this road, we had 5 days to put a proposal together. And that meant looking at what kind of building was available even, for acquisition. And so for us, it was a rush. And then it was kind of like, okay, we submitted this. We don't know if it's going to be, selected even or whatever. So I didn't really know whether it was appropriate to even say anything. Plus, it is under procurement. And so I didn't think that it was appropriate, to be able to share this stuff with the public yet. When we did find out, it was the very next day that headline that IHS was coming to Chinatown under the COVID funding was plastered on, the Star Advertiser. And we didn't even have a chance to really explain, it was already, a fire that was set, and we've been busy trying to clarify and, really inform people more. And Councilmember Fukunaga, I did try to reach out to you, and I'm sorry I didn't get a chance to talk to you, after that, but I did try to call your office.
Thanks. And just to kind of share a little bit more with the group out there, we're not trying to scapegoat or say we're not taking responsibility for communicating with the community. That's what we're definitely trying to do. The community actually found out before our board found out. So when we saw it in the newspaper, you should have seen Connie's and my face. We were in utter shock because literally you guys were finding out pretty close to when we found out. So it was a shock to us too. So we definitely apologize, and we understand your shock. You should have seen our faces too. We were in shock as well. So deepest apologies for that. And we will definitely make sure that going forward, there's always open communication about this project with the community. Our phone numbers are on the website as well. So if you have any follow-up that has not been addressed through this forum, please reach out to us, because we value your insight, and more than your insight, your suggestions and thoughts on how we can improve the community. You know, we hear the negative feedback, but we want to make sure that it's constructive as well, that we can mold that area for the better for all of us. Okay, so a little bit more on safety. I guess safety is a big concern. So I guess on security guards, will there be security guards?
I think, you know, people might be really surprised to hear that we have no security guards across all of our, you know, shelters and our sites of service. And that is because we actually train our staff to be able to de-escalate people. A lot of times I think better than security guards, but, you know, that's something that I'm open to as well. You know, we really have to see, you know, what it is that is needed. And if it is needed, I am open to that. But I do have to say, you know, I have seen, you know, the security guards that have been with us at times. And, you know, I'm just, put it this way, I'm just really thankful for my staff and what they're able to do.
This one's from JL808. What data, research, or models from other cities or counties have you used to plan a successful program for the homeless in Honolulu?
We've done a lot of different things. We were the first Housing First program, you know, to be funded by the city. And I'm really proud to say that we've been very successful. Our sustainability rate in the housing is it's close to 90%. And, you know, we are very proud of also the rapid rehousing programs that we have. I think that a lot of times we take programs that are started on the mainland and we tailor it for our local community. I don't believe that you can just lift a program from the mainland and just bring it over here and think that you're going to have the same, you know, impact. But I do think that we learn a lot, you know, from a lot of the programs there. So we actually pay close attention to the National Alliance on Ending Homelessness and all the programs that they recommend. And in fact, all the recommendations that they had for the COVID response, we actually put it in place before they came out. You know, so I'm really proud of, you know, the track record of our staff and, you know, just the way that we've been able to take what is given to us and really make it ours. And when I say ours, not IHS's, but our communities, you know, and really tailor it to our folks that we're serving. I'm just wondering, you know, about other types. Oh, even the shelters, you know, like the shelter guidelines, the Halemaliola shelter that we started with the city. And like after 5 years, I think it's really been a learning experience, but it's been a really great one for bringing people in and having their own little unit, small as it is in a container. That one container divided in 3 for one each, you know, for people. And then we're also innovating with Dwayne Karisu with Kahawiki Village. You know, that's another homeless, formerly homeless community. They're all families with children almost, and that has been going really well. You know, so I think there are a lot of different programs that we have, you know, really put in place and really tried our best to implement in a faithful way to the things that make it work, but give it our own local twist.
Okay. Another one from JL808. Is your program going to feed your audience in a similar way to River of Life mission?
Not in the sense that we're not having mass feeding. We're just feeding the person that we're bringing in. And, you know, right now it's at the max, like maybe 6 people, you know, so it's not a whole lot of people. And really, it's like we're not necessarily feeding them every meal if they don't have to stay there the whole time. But if they're staying there, of course, you know, we will make sure that they're nourished well. This
is a comment from Caroline Oda. This is a great project. It just has to be put in the best location in Chinatown for residents, small businesses, and customers, as well as for the mentally ill. Definitely agree with that.
Thank you, Caroline.
Okay. So this one's from Fran. Safe Haven tried to empower staff as guards, and that didn't work. So I guess how would this be different than Safe Haven?
I can't speak for Safe Haven. I can only speak for our staff. And Justin is somebody who came up through the ranks as a resident assistant. He actually, maybe Justin, you can share a little bit about how you started at IHS. Real quick.
I started out working in the shelters on the ground and worked in a lot of team maneuvers with providing safety and security in a shelter. And that same training and same experience has been translated into the outreach program. We've only had one incident in I think the 8 or 9 years that we've been operating an outreach program where we had one dog bite a staff member one time. Other than that, our incidents are mainly tripping down sides of cliffs and falling in ditches and things like that if we're walking through the woods or whatever. So we've had a very safe program, and so we don't have a lot of incidents. A lot of times, we just offer somebody, just the opportunity to have a cup of coffee or just hang out and talk stories. And in doing so, the situation de-escalates itself. It doesn't really require a lot of skill. It just requires the ability to sit down and be willing to have that conversation with the person. So in that sense, we think that we would probably have a very successful and safe work environment in Chinatown.
I also want to add that many of our staff, particularly our outreach staff, have lived experience. They have actually experienced homelessness in some cases, or other kinds of things that are very common among our population that we serve.
Okay, this one's from Missy and Jeff Mull. Our neighborhood and businesses are falling apart due to COVID. I agree with you. It's taken a ginormous toll on all of us. And your lack of communication and outreach are making this extremely hard pill to swallow. I feel like we're being kicked when we're on the ground. So I guess the question, no question. What's the question? Sorry, I want to make sure we're addressing the tough questions as well as just the friendly questions to us as well. So I guess, how does this relate to COVID and how can we help out the community? Is that the area you guys are wanting to go in, Jeff, with Missy and Jeff? Let me see.
I think it's important to understand what happened when COVID-19 did hit us. It wasn't something like, all of a sudden, we had the answers in front of us. The COVID-19 thing developed as we were moving through each day. And so what happened when they shut down the Ala Moana Beach Park and Kapiolani Beach Park, you can't go into them. So where are people going to go? Everyone automatically rushed into Chinatown because the River of Mission was there. IHS was over on Eva Lay. And so all these homeless people came in when they were released from jail. Where were they released to? They had to come into Chinatown. And so what we've seen is this overpopulation of homelessness coming in. We've seen the worst of the worst. And now as things are going to start to kind of open up, we can see them start to go back to the areas where they came from. But again, what's left behind. And, I think that we have an opportunity here to work on that hardcore group. The slides that we're showing, there was this picture of these two homeless people in wheelchairs and a person laying on the ground. Those pictures came from a referral. Somebody in the community made a email of concern about those people. We were able to address it and get those people out of the area. Yes, it takes us a little bit of time. Sometimes, 3 days, sometimes 2 days. Other times it may take us a little while, a couple months. Senator Rhodes wrote in his question about the bus stop below his building and the homeless piling up there. There was a heavy-set African-American female there with one shopping cart, a big old large shopping cart. That female today is taking medications. She's living in a home. out in Waianae or Wahiawa someplace. She's being taken care of. And so, you know, that wouldn't have been possible had the team not been down there engaging with Dr. Koyanagi and doing the work we do. And so I definitely think that, you know, the community in Chinatown is going to see an impact by the team being present. So, yeah.
And I want to say that, you know, I definitely sympathize, you know, with all the shop owners in Chinatown. You know, even early on, people weren't going to Chinatown because they, you know, kind of related the COVID to Chinese people. I'm a Chinese person. I'm 100% Chinese, you know, so I get it. You know, I really felt like, wow, that's kind of interesting. But, you know, I think what we're about is trying to help you get back on your feet and revitalize Chinatown so that you can get back to where things were before. You know, that you had a dream of doing some of the things that you were doing there. And we want to be a part of helping make that happen. I'm sorry that, you know, it's what we're trying to do seems like it's just the opposite. But, you know, the intent on our part definitely was to try to make it a better place, you know, to just recapture, you know, that the attraction that Chinatown had for a lot of people, you know, a lot of memories, you know, there too.
Okay. So I want to make sure I'm getting to one of Joyce's questions. So I agree that services need to be provided for the homeless, and this is from Joyce Lung. However, has IHS completed an environmental and community impact study? Also, Chinatown is already a highly dense community accommodating vulnerable population, immigrants, seniors, students in schools as well. So I guess, have we done an environmental impact and community study?
Honestly, no. And I think what we have relied on are our observations of the staff that have been in Chinatown. But we welcome, you know, whatever data that you want to share with us that really, you know, kind of contributes to the decisions of whether we should be there or not. You know, as I said before, we're not trying to push our way into Chinatown. It really was a genuine offer of assistance, and that's where we're coming from.
Mm-hmm. I also want to follow up on that. We will be doing an environmental impact study. There's a good amount of due diligence that needs to happen before this property closes and before everything moves forward. So there's many more steps, and we'll have a lot of time and opportunity to be sure to get everybody's input and hear your concerns and questions and really ways to improve the community. And this one's from Chelsea Davis. What is the timeline?
Maybe Elena, you can answer that question because it depends a lot on the acquisition.
So I think the timeline of something like this really depends on the different steps. There's HUD steps, there's that environmental assessment, there's a multitude of items that need to be addressed. So I can't give you a real firm timeline, but we definitely would want to try and be up and operational in a year so that we can be providing services soon. Because again, the goal is to really mitigate the impact of the spread of infection. And so Connie and I are both nurses. And so when we hear COVID, yes, for us, COVID is one disease and it's horribly plagued us, but we want to be ready in case COVID comes back around. If it's SARS number 23 or bird flu number 18, we as a community should be ready to prevent the spread of disease regardless of what sort of disease it is. Okay, this one just says, thank you for helping our homeless neighbors. That was sweet. Sorry, I'm trying to scroll through your questions. Okay, this one comes to property value. Can you speak about the loss of property value in and around the area?
You mean like whether it's going to happen or whether
I guess so. I guess that's is that the question?
Well, I'm going to assume that that's the question. So
yeah, okay.
My intention is that my hope is that it actually increase the property values, because if we're able to clean up the area by taking people off the street who are so much plaguing this community, I think that it would definitely help people feel like it's a community they want to be in, and that it would add to property value.
Okay. And then, due to the possible increase in homeless population in the area, if we open, how are we going to address safety concerns when not open?
And
We don't really expect to see people there when we're not open, and they shouldn't be hanging out inside of that building. So, safety and security, we're bringing in 4 staff that are going to be assigned to Chinatown to do outreach in that area throughout the day, and then 2 at night. So we're really hoping to change the model that we've been using in the past and to apply some new ideas that we've been working on. So when the building's closed, we expect there to be, nobody around or any safety or concerns at all.
Or Justin, sometimes if there are people sleeping over, we would have staff, and if anything was going on, then I think that the staff that are present are available to actually deal with some of the situations outside. So I think that would be an added value, for the community itself, to have people who might be there at night.
True.
Awesome. So more questions on safety. I'm going to skip over the questions on safety because we had a lot of similar ones. If you have anything specific, please just feel free to type it back in. You got a kudos, Justin. Somebody said, I remember Justin from over 10 years ago, and he's genuine. Props to IHS for dealing with people who others don't want to deal with. So I think the work you do is by far more than the population of Hawaii has offered. Everything they say is relatable, and my family has benefited from their due benevolence. That was sweet.
Thank you.
Thanks. Okay. And Hillary said that female you're talking about was knocking on her Baratania entrance a few weeks ago. So do you guys want to touch on the takedown, the list of clients?
We can't go into any names. That's something we
in general.
But yeah, we've done quite a bit of work down there in Chinatown. We're working with one guy over by the Alakea courthouse right now. Right now we're waiting to place him in housing. And the problem is that we need a place to give him a shower and clean him up real quick to go in for the housing appointment. So we're working with the case management, and once the housing program lets us know that they have a viewing for an apartment, we're gonna pick this guy up, take him over to Punahou Rest Stop, get him an appointment, get a shower, clean clothes, and move him out of the area. We also have moved another female out of the area. She would sit out in front of the buildings and just kind of, use the bathroom and stuff like that in the area. She's one of these people that just pull her pants down, no problem whatsoever. So we ended up MH2ing her over to Queens, and she ended up going to Keikela, got out, and she's stably housed now out in Waianae. So these kinds of situations are just gonna open up for us by being down there. One of the gentlemen, he would frequent the area. He always had these large wounds on his lower legs. And when even like the Hawaii Health Harm Reduction team, they would go out and do the medical wound care for him. They'd take the wound care off. It just stink up the whole room because the guy was not able to get a shower and clean clothes and take care of himself. And so what ended up happening is he ended up getting hospitalized. Come to find out he's a veteran, he's got honorable. So we helped this gentleman get into the vet house through a housing resource, and now he's stably off the streets. This is one of the guys who would go to the hospital or get arrested a minimum of 3 to 5 times per week. This is the kind of interventions that we're talking about going after, folks that are creating chaos in the community, folks that need the most help. So folks like this is the ones that we're going to go after. Connie was talking about the 3 folks that had the bald head shaved. What we know is that in these communities where people like around the park in Chinatown, they congregate in that area, and then they transfer this lice and these scabies to one another. And so we're focusing on these kinds of folks, not only through the assisted community treatment petitions, but we're also doing it through guardianship. We're also doing it through intensive outreach. You know, maybe people don't need that kind of services, the court-ordered stuff, the intense medical stuff. Maybe that person just needs me to encourage them to use my phone to call heli to work so they can get their job back. We're proposing a variety of programs, but we also really want to focus on these folks that are causing the most problem for Chinatown. And so we think we can do it with 4 new staff members and bringing in our intense case management team, bringing in a psychiatrist, and being the boots on the ground for the community on a daily basis. I hope that answers the question.
Okay, this one's from Kevin McDonald, chairman of the Downtown/Chinatown Neighborhood Board and candidate for State Senate in District 13. Thanks, Kevin, for writing in. As a resident and business owner in Chinatown, I believe that these types of organizations that coddle the homeless and try to earn their trust are actually enabling these people. Since Word of Life and other homeless advocate groups have moved in, we have become overrun with homeless, and the problem is only getting worse. Don't you think our money would be better spent on a kind of holding center outside of any residential or business community where they can be set up, sent upon arrest, because many of these people are frequent lawbreakers. Then, once inside the holding center, they can be sheltered, fed, bathed, and other services can be offered. This would remove the individual from the troubled community and provide a sort of captive audience opportunity for you to offer them some sort of help they need. Why would we prefer a program like this?
Are we talking about arresting people?
I guess he's talking about arresting people who are frequent lawbreakers, and then a holding area outside of Chinatown. So I think there's a couple components. I think a little bit on the post, a little bit on, following, people breaking the law.
So that kind of sounds a little bit like the SMART program that we had proposed, which is really trying to escalate some of the sentencing a little bit for some of the folks that commit very, very petty crimes, because a lot of the things that people get picked up for isn't going to keep them in jail for very long. I think what Kevin describes is something that we could work toward if we just tweaked our system a little bit, because that holding place could be the jail. But, if we could, right now there's the LEAD program that redirects people and says, okay, well, if you don't want to go to jail, then you need to go and, get treatment. The problem with that is because there's hardly any time that you have to spend in jail. Many times they get picked up, and then when they go to court, they're just let out again. So we're trying to look at changing the laws a little bit so that we might be able to actually make something more like what Kevin's describing happen. Yep. There needs to be some for people, and there needs to be, a way for people to get access to treatment, because that's the bottom line. You're not going to change much unless somebody actually gets treatment in a lot of cases. So I think, when, you have the idea, I think, we have to work with the systems that we have right now, and certain, legal issues don't permit some aspects of it, but willing to work with you on that one.
And just to share some of the comments, this one's from John Nakal. His comment is, thank God for IHS for their great efforts and success in helping the homeless to stabilize, find shelter, and in some cases, become self-sufficient. It seems that the homeless population everywhere, especially in Chinatown, has increased. As long as River of Life, as a longtime River of Life volunteer, a triage and comfort station in Chinatown is much needed to serve and stabilize those with mental and physical illnesses. It will improve the appearance, sanitation of Chinatown and our city, reduce crime, and most importantly, direct homeless to housing to further stabilize and make productive their lives. Chinatown needs the triage and comfort station in Chinatown because this is where the concentration of homeless is located, and likely those who need the most help. Thank you for that, John.
Thank you.
Okay. Okay. Question from Missy and Jeff Mall. We know you do important work. That's been established. Can you please answer questions regarding project? Will you be kicking out, relocating any of the businesses in the building at the proposed location?
Lena, you want to answer that?
Yeah, I'll take that one. So right now we're in discussions with the tenants. Some of them do want to move, some of them do want to stay. So we'll continue those discussions. And first we need to figure out what everybody does want to do. This property was on the market. It was listed it's been publicly listed since 2019. The owner does want to sell. They're very much looking forward to having the building sold. Currently, the expenses and costs of the building were more than what they were bringing in. They also are residents of the building as well. So it's the owner who also occupies the building that is selling it. There are some businesses in there, specifically two on the bottom floor. And so we've been in talks with them, and we will make sure, we're in the business of taking care of people. We're in the business of housing people. So by no means would we put somebody out, a business out that hasn't been properly taken care of and relocated if relocation were to happen. And we're still, again, we're still in the very early stages of this. So we need to do more due diligence, continue to work with them and to figure out what first everybody wants to do, and so we can work towards the best outcome. They also had a couple other questions. Have you reached out to the city council regarding this project? Connie, you want to take that one?
Sure. We just appeared before the Economic Revitalization Committee 2 days ago. Yeah, and we were wanting to address as many of the council members as possible. And I have, as mentioned earlier, tried to reach out to Council Member Karen Fukunaga, and I've spoken with Tommy Waters. And the others that were present, at the last meeting also. So, we're definitely trying to reach out to everyone involved, and, wanting and being very transparent about everything. We don't want to hide anything. We really want to, get with everybody and hear what everybody has to say and find common ground. I mean, I really feel like there's too much, polarization of all issues, and I'd really love to make this an opportunity to bring Chinatown together.
Okay, we're just going to do two more questions, and then if you're missing any big answers, we can be sure to follow up with you individually after this. So this one is from Joyce. Historically, Chinatown has been connected with negative impact. Since World War II, Chinatown was negatively impacted by many bars and dance halls servicing servicemen, but that has gradually been cleaned up. River of Life Mission has been a huge attraction of homeless. Now IHS is going to add. There's been many immigrant seniors being robbed, accosted, and now are afraid to visit Chinatown. So I'm actually want to take that one. So to be really clear, yes, some homeless people follow service providers, but it's really the vices that people follow. It's the drugs. It's the drugs that are coming off the boat. It's the prostitution. It's the alcohol. It's the gambling rings and houses. So it's the service providers go to areas where there's a high concentration of poverty, of blight, of things going wrong. But usually what's drawing and creating the challenges are not the service providers. It's the situations that are going on in the community. So we as a community, if we're gonna really clean up Chinatown, it's gotta be more than just IHS. It's gotta be more than just River of Life. Every business has done their part in there to, set a firm stand and to clean up the streets, to have no tolerance, to try and revitalize the area. We need to also try and get the drugs off of the streets. We need to try and get the prostitution off of the streets, because it is not the providers that are bringing the homeless to the area. It is the drugs, alcohol, prostitution, the dark side that's creating the homelessness. The providers are not creating the homelessness. It is the negative, you know, aspects that have been created before the providers came. Okay. And then this one's from Chelsea. Do you have any visual elements for the center? Plans or renderings? Chelsea, going back to the piece on, we're still in the early stages. We're also still working with the tenants. So we don't have any renderings or anything because no decision has been made on the building in terms of if we're going to be using the whole of the building or if it's going to be a portion. So a lot still needs to get done. So I guess right now we just need to finalize the concept and then we can get you guys some renderings and drawings. Okay.
You said 2 questions, Lena.
Okay. So I think we got most of, the questions answered. I really thank everyone for joining us today. I think you guys have had some great questions and thoughts on how we can address the issues. And do you guys want to sum anything up, Connie?
I think, again, I want to just stress, you know, if we can build synergy, you know, between service providers, and at least I can only speak for IHS, building synergy with everyone in Chinatown, whether you're a shop owner, whether you're, you know, doing ministry downtown, whether you're another service provider. We just want to work with everybody, you know, because we feel like come together, we have the best chance of actually being successful. When we work in silos, you know, it just doesn't give us the impact that we want. But when we are kind of like watching out for each other, you know, just like a neighborhood watch, and I know you have one of those, but we're also looking at the service providers as your allies and understanding and knowing them, because I bet you most people don't even know the plethora of resources that are available. I know that for IHS, we want to bring the whole bandwagon of, you know, what we provide to Chinatown and, you know, really be able to, for you to benefit from that. So I just want to end with that. I just really hope no matter what happens, we want to be a partner.
Yep.
Thank you everyone for joining us.
Mahalo.
Thank you.
Okay, how do I